Jobs in the healthcare sector are both in demand and demanding. But what I found out when I spent the day at Harris Health System is that they are more rewarding than almost any other kind of job out there. Harris Health operates 2 hospitals and numerous clinics in the Houston area, and they have earned a stellar reputation for both their quality of care and treating patients with compassion. It can be a difficult balancing act, and today I was going to see how they achieved it by spending the day at Harris Health's flagship facility, Taub Hospital.
Wow. I'm stepping into the future.
So technology is changing the way healthcare is practiced, and so as you walk into this room, you can see our commitment to technology and the future of healthcare.
So for you to invest in machines like this, you have to have a lot of volume. I'm assuming you have a lot of patients. Like, how many?
We probably see as a system probably about 300,000 people on an annual basis.
Wow.
Yeah.
Okay. So you being in human resources, you probably work a lot with hiring, with recruiting
I do.
staff. So how do you convince them to work at Harris?
One of my favorite sayings is some people are destined to succeed, others are determined to succeed. And so this is a place where people are determined to succeed.
Oh, it's that growth mindset.
Yes, absolutely.
Yes.
People are desirous to come and work here. The people that we attract are those persons who are compassionate. And obviously being a level 1 trauma center, one of only 2 level 1 trauma centers in Houston, we're able to attract people because they want to come and work at a place where they know that there is that level of service absolutely going on and taking care of those types of parts.
All right, well, which one of these snazzy new rooms do I start in?
I think we got another job for you.
I expected my day to start at Taub helping around the medical center, maybe learning about x-rays or meeting patients. Turns out they had other plans for me. At Harris Health, quality service doesn't start in the hospital. It starts in the community. The organization has spearheaded a variety of programs to promote general health and well-being, which I got to experience for myself at their farm. You heard me, Harris Health has a farm.
It's crazy to be a farmer and be employed by a county hospital system.
Best of both worlds, actually.
Best of both
worlds. You get to be outside, you get to do this, but you're also working for an organization that is trying to heal people.
It's been with a lot of care, a lot of volunteer hours helping me out here, making sure that we can get this field cultivated. We have such beautiful, healthy tomato plants that we've already been harvesting from and donating to folks in the local community right now.
Can I help you harvest?
Yes, please. These are our Sun Gold cherry tomatoes, my favorite. And these will be donated to a local senior center just about 1.5 miles away from the hospital.
So what's the relationship between this farm and the hospital?
We understand that we need to be thinking upstream as well as downstream. That's what this farm is. It's an opportunity for us to provide and begin the conversation of what healthy food and wellness is.
I almost want to give this baby a chance to get a little bit more.
He's ready.
He's ready?
Yeah, he might be small, but he's like perfect in color. Bon appetit.
Wow.
Yes.
I'll take a tub of these any day.
Okay, out of the garden and into the hospital. Rocking the scrubs, I might add. But most importantly, I was learning about one of the most important jobs at any healthcare facility, nursing.
So let's start an IV. All right, so let's put on our gloves. First, you're gonna grab your catheter.
Okay.
And you're gonna get an IV start kit, which is this.
All right.
So next, grab your tourniquet and apply it above, not too tight, but not too loose. So grab the catheter. This is gonna be a cleaning agent. You're gonna click it together, just like that. See?
Oh, you can see it fill with the
Yeah,
alcohol.
right.
Okay.
So we're gonna scrub up and down this vein here. Put your hand up here and you go here.
Just right in this way?
Yep, just like that.
Right here?
Yep. And let's hook up our extension set. Perfect, you're doing so good. And then you take this off, just like that. Yep, it goes right there. Push it, push it, push it. Give it a good push. There we go. And start. Great job, good job.
Needles always made me squeamish, and even using one on a dummy was kind of intense. But drawing blood may be the easiest part of a nurse's day, as I was about to find out.
All right, so this is our simulated limb, right?
Okay.
It's not a real limb, but it has a couple different injuries on it that we're gonna practice packing so you can kind of see. We're gonna start with this laceration wound right here. You're gonna go ahead and take a couple pieces of it, and then you're gonna stuff it in the wound.
Okay.
So we can go ahead and say that you've put all of that in there, and then what you're gonna do afterwards is you'll put this on top, and then you're gonna hold pressure. So we packed it, and now we're applying pressure on top of it as well. That's gonna stop that bleeding. If you wanna go ahead and simulate that, perfect.
How did Harris Health develop this program?
So they developed it quite a few years ago. We have adopted American College of Surgeons as one of the main key players in this. That's made it a national program after the Sandy Hook shooting. And we have started implementing it in schools. We've taught a bunch of our employees. We have kits all around Harris Health in case something were to happen here. We want our staff members to be prepared. You know what? You did a really great job today. And you know, you have done such a great job holding pressure, but you can let go now. Your patient has been saved. EMS has arrived.
He's in your hands.
Thank you.
One thing was becoming clear. The medical professionals at Harris Health were some of the best in the business and were trained to handle any situation, even ones that took place on a grand scale. I saw this up close when I spent time with the trauma team.
First things first, we got to put them on the monitor. We're going to monitor EKG, blood pressure, pulse oximetry. You have to put this on. Okay, so inside here, everything that we need is right here. And then it's got a list of everything. We have to make sure that this works. If that light isn't working, they can't see inside there. All right, Crystal, I think we're ready to go. Our room is prepped. Everything's been checked off. We're ready to go. They're going to be here any second.
Wow, that was intense. But all the while, the people I was working alongside were quick to remind me that healthcare isn't just about big moments as they are about personal interactions. And I couldn't have been happier to be a part of this one. For most people, the hospital can be a scary place. I know it is for me. At least it was until I got to spend time with the dedicated professionals at Harris Health. The men and women who work here are a special breed. They understand they aren't treating problems, they're treating people. Whether you're a patient or an employee, you're in good hands at Harris Health.